If you look at COVID-19 and actually the elections, how are you expecting briefings to change, but also lockdowns to be put in place depending on who wins today?
I think that the communication with the public could only improve if there was a change in administration. And I think that the public health measures that are put into place would only improve. That doesn't necessarily mean that lockdowns are what's in the future. We have to remember that lockdowns were used at a time when things were very dire in the country, where we had no ability to test, we had no contact traceability, and we had hospitals inundated. I think that right now what we'll see is much more targeted public health, even as we move, even if there is a change in administration or if there's not a change in administration, that people have now realized that lockdowns have a lot of ancillary consequences in terms of other care for other medical conditions, in terms of the economy, and that you only want to do that if you're in dire straits and only for a very, very short period of time with clear metrics for lifting, not kind of an unending lockdown. So I don't think that that's what the United States has in its future. I think that that's sort of the European model, and that's the Wuhan, China model. I think we're going to get to hopefully a better test, trace, isolate model where we have very targeted measures when there are surges.
Dr. Adalja, if we cannot do a federal pandemic model, how does the federal government, assumed under President Biden, how do they impute a medical plan, a Dr. Fauci plan, upon governors and upon mayors?
Well, what we need to do is go back to what we've always done, and that's having the CDC lead a public health response. And what the CDC has done in the past is support states and local governments by having very clear guidance that is evidence-based, making their experts available to local and city governments and health departments so that they can actually implement that, and really talking to those individuals every day, trying to help people understand what's going on with the dynamics of the virus, come up with ways to think about relative risks of certain activities and how to make things safer. That's what happens in any other pandemic or any other infectious disease emergency. It's just that since February, when the CDC spoke frankly to the public, the president basically put them in the back seat and handcuffed them, and their whole modus operandi at that time became pleasing the president versus actually looking at reality.
Amesh, what is the reality? What actually works? So, without talking about lockdowns, do non-important stores or non-essential stores need to close? Do people need to wear masks? Like, what have we learned about the virus and how it spreads? Is it different from what we knew back in March and April?
I think it's definitely different. Well, the biggest difference is that we know that pre-symptomatic people who don't have symptoms yet, can spread this virus, and that's where the mask recommendation came from, that there are people out there that have the virus that don't know it, that are contagious, and face coverings help to decrease the force of infection. That's the simplest thing we can do to avoid any kind of lockdown talk. If we can get people to wear face coverings very diligently, we will see a decrease in spread. The other thing is we should encourage telecommuting. We should encourage online ordering. We should have a lot of mindfulness when we're having mass gatherings, and we have to get people tested and traced, and people have to pick up the phone when the health department calls for contact tracing so that those contact tracers don't have half of the calls going unanswered and half of those cases not even being logged. So that's what works. We've seen it work in Taiwan. We've seen it work in South Korea. It's becoming harder and harder to have it work in a place like the United States because we keep getting more and more cases because we fail to do it. But it will work, and it's been shown to work, and I think that's what we have to get back to is masks and test, trace, and isolate.